Hello everyone. So today we are going to discuss weight loss. We are going to discuss the differential of weight loss along with their management. The differentials of weight loss are very simple to memorize because if you remember the alphabets A, B, C, D, E, F, G, and H, then each alphabet stands for one of the differential of weight loss. Okay. So starting with the A, the first one is anorexia. So anorexia is basically a psychiatric case, and here the weight loss is intentional. Okay. When you ask the patient, are you planning to reduce weight? They will say yes. Okay. So here the weight loss is, intentional. Then TB. So in TB, the B is basically like in the morning, the B stands for TB. So the TB patient will have classic symptoms of TB, that is low grade fever. There will be a prolonged history of cough, like it may be 6 weeks, 8 weeks, okay. Prolonged history of cough, which is productive cough with sputum and blood. Okay, he will have low-grade fever, weight loss, night sweats, and there will be a history of positive history of travel to endemic areas like South Asia, like Africa, or there will be history of a positive contact with similar symptoms of positive contact with a diagnosed patient of TB. Okay. Then C stands for cancer. So cancers, you have the mnemonic falls for the cancer symptoms. So the patient will have fever, he will have appetite loss, he will have significant weight loss. There will be lumps and bumps in the body, that is enlarged lymph nodes, and he will also have night sweats. Okay, so C stands for cancer. The D here stands for diabetes. So diabetes also presents with weight loss, but the patient will have specific symptom of diabetes, that is polyuria, polydipsia, polyphagia, that is increased hunger, etc. And he may also have a positive family history of diabetes. Okay, endocrine. So in endocrine, the hyperthyroidism is the one that is important for weight loss differentials. So hyperthyroidism, the patient will present with what we call as BMW, that is B stands for bowel, so diarrhea, and mood. So mood will be irritable, and W is weight loss. Okay. The patient will also have fine tremors and heat intolerance. So he will say, I feel hot when other people feel normal. Okay. I feel I cannot tolerate even a little bit of heat. Okay. So the endocrine, and then we have nothing stands for F. Okay. There is no important differentials for F. So you will have to skip that. And then for G, we have GIT. So malnourishment. Okay. Either have the patient might have history of any malnourishment. The patient might not be taking appropriate nutrition, or there will be signs of malabsorption like tummy pain, diarrhea, and difficult to flush stools. Okay, like IBD, okay, pancreatitis, etc. And H stands for HIV. So the HIV patient will have history of IV drug abuse with needle sharing, okay, or he may have positive sexual history where he's not practicing safe sex and multiple sexual partner, etc. Okay, so basically the differentials of weight loss are A, B, C, D, E, skip F, and then G and H. All right. So whenever a patient presents to you with a complaint of weight loss, doctor, I feel like I've been losing weight. Okay, so here you cannot ask Socrates and you cannot ask Odipara. Okay, none of them fits here. So instead you have to modify your approach a little bit. So you will ask, when did you notice that you've been losing your weight first? Okay, when did you notice first? So how much weight loss was there and over how much time? Okay, this is important. How much weight loss or how much time? Because if it's like 6 kg weight loss over 1 month, then it's very significant. And if it is 2 kg weight loss over 4 months or something, then it's not really significant. All right. Was it intentional or by any chance? Okay, by any chance, was it intentional? This is the question that is to rule out anorexia nervosa. And how is your appetite? All right. And apart from that, you will say anything else. So this is basically the first, the thing that we have modified for Odipara. So when did you notice first? How much or how much time? Was it intentional? How is your appetite? After this, you will say anything else and you will start asking the DD's questions. Okay, the DD question to rule out specific DD. So we have already asked the question for anorexia nervosa. Was it intentional by any chance? Do you want to lose weight? And for anorexia nervosa, there are other specific questions as well. I will discuss anorexia nervosa in detail in psychiatry, okay? But in general, in the weight loss station, you need to ask this question to rule out anorexia nervosa, that is it intentional? Do you want to lose weight, okay? For TB, you will ask about fever, cough, and night sweats. For cancer, you will ask fever, appetite loss, weight loss. Weight loss the patient is obviously presenting with, so you will ask appetite loss, lumps and bumps in the body, and night sweats, okay? And for diabetes, you will ask, do you feel like you've been going to the loo quite often, and do you feel more thirsty more than usual, okay? And appetite for polyphagia, you already asked about appetite. In endocrine, for hyperthyroidism, you'll ask about the hyperthyroid symptoms. So how is your mood lately? Do you feel hot when other people feel normal? Do you feel fine tremors in your hand? And do you have any change in the bowel movements? Okay, for diarrhea. So these are basically the DD's questions. For HIV, you will basically ask questions here in the lifestyle. Okay, so P2, for P2, you will ask, has this ever happened before? Any history of any other medical disease, medical illness like heart disease, high blood pressure, diabetes, etc. And then you will ask about medication, allergies, family history, and then the psychosocial history. Okay, so what do you do for a job? Who do you live with, etc. Lifestyle questions are also important. So cigarette smoking, alcohol, diet, exercise, and then the DX, which are basically the drug use and sexual history. This is really important in case the patient has HIV. So for HIV, you will ask the question here: are you sexually active? Do you have a stable partner? Do you practice safe sex? And do you use, by any chance, do you use any recreational drugs, and do you share needles? This part of the history you will ask here. Okay, after this you will ask about ideas, concerns, and expectations. Do you have any idea what might be the cause of your symptoms? Anything that you are specifically concerned about? Any expectations, any particular expectations from the team today? And then you will do your examination. You will do your general physical examination. You will observe the vitals. You will examine, you will listen to the heart sound and chest sound, and you will examine the tummy. Okay, so management. I'm going to explain the management of hyperthyroidism here, because in anorexia nervosa, I will discuss in psychiatry. Tuberculosis, I have already discussed in the cough video, and diabetes, I will also discuss, like diabetes, I will discuss in specific scenarios like in DKA, treatment refusal, and stuff like that. So it's not needed here. And so I will discuss the hyperthyroidism part, because HIV I have also already discussed. So I will discuss the hyperthyroidism here, and for the completion's sake, I will discuss the management of hypothyroidism here, so that it's not, left. Okay. So for hyperthyroidism, for management of hyperthyroidism, you will first of all explain the condition to the patient, that there's a gland in front of your neck. Sometimes it is hyperfunctioning and it releases excessive hormones, and that's why you are feeling these symptoms. We will inform our seniors. Okay, we will do some investigations, that is routine blood tests and thyroid function tests. Thyroid function tests include TSH, T3, and T4. Symptomatic treatment will be provided by the GP, that is beta blocker. Okay, so symptomatic treatment is beta blocker. They are given till the antithyroid drugs take their effect. So beta blocker masks the symptoms of hyperthyroidism, like diarrhea, irritability, tremors, etc. Specific treatment. So GP cannot prescribe antithyroid drugs. For this, they need to refer the patient to the endocrinologist. So we will tell the patient that we are going to refer you to a specialist called endocrinologist. He will start you on some medications called carbimazole. And these medications aim to reduce the production of thyroid hormone, and your symptoms will normalize with that. However, you might need to take these medications for several years. So unfortunately, it's quite a long-term treatment. The patient asks, is there any other treatment? Then you will explain about radioiodine. Otherwise, you don't need to explain about radioiodine. So radioiodine treatment, how you are going to explain it to the patient. Radiation is used to damage thyroid gland and decrease hormone production. Okay, so you'll tell the patient that in this treatment, we use radiations to damage the thyroid gland and decrease the production of hormone. You will be given a drink or a capsule that will contain a low dose of radiation that will then be absorbed by your thyroid gland and will slowly destroy it in order to decrease the production of hormone. Okay, as we are giving this patient carbimazole, Okay, so for safety netting, you will basically safety net the patient for the symptoms of thyroid storm. So fever, diarrhea, vomiting, irritability. So I'll tell the patient if you feel like your body temperature is rising, you have severe diarrhea, you are vomiting, you are irritable, then please call 999 or come to the emergency department. And as we are giving this patient, we are not yet giving this patient carbimazole. The specialist will be giving. So you don't need to herbalize it here, but with carbimazole, one of the side effect is agranulocytosis. Okay, and agranulocytosis, it is one of the most feared side effect, and it can be potentially life-threatening. So when we give carbimazole to the patient, we also safety net them about any sign of infection, any sore throat. You need to visit your GP. Okay, so for example, not in this station where we are just we have just diagnosed the patient with hypothyroidism and we are referring to the specialist. For carbimazole, we don't need to herbalize it here. They'll be told by the specialist. But in a diagnosed patient with hypothyroidism, if he's on carbimazole, then we need to herbalize about any sign of infection, any sore throat, then you need to visit your GB. Okay, we will tell them that as you will be on these medication long term, so we need to follow you up regularly. So you need to regularly follow up with the GP for any medication, for any dose adjustment medication, and we'll keep monitoring the level of thyroid hormones in your body. Okay, also we'll tell the patient that if you are planning to be pregnant, then you should, consult the GP before doing so, because your medication then needs to be changed. Okay, no need to tell the patient that we need to change a carbimazole to PTU. Just tell them that medication needs to be changed. This is for your own information, that for an hyperthyroid patient, who are taking carbimazole, we need to consult them about pregnancy, that whenever they are planning to be pregnant, they will tell the GP in advance of that, because the carbimazole need to be changed to propylthiouracil in the first trimester, and after the first trimester, they are again put on carbimazole. Okay, I'm discussing hypothyroidism here because it might be left, but it has no role in weight loss. Okay, because hypothyroid patient present with basically weight gain, but for completion's sake, I am discussing it here. So hypothyroid patient will either present with weight gain or tiredness, because these are the predominant symptoms, but may also present with constipation. So whatever symptom the patient present with, you will take history according to that. So we have already discussed the history of weight loss, but with weight gain, you need to ask say some questions like, is it intentional, and how is your appetite? Can you please tell me about the food that you are taking in a day, etc. Okay, and any other symptoms, and then you will ask about the hypothyroid symptoms of maybe Cushing disease, which also present with weight gain, and Meftoza, Kefedex, and then examination. In examination, you will do the BMI and then management. Okay, the tiredness history I have already explained, and the constipation history I will explain in detail in the coming video. Okay, so in management here, you will inform your seniors, you will do investigations in similar way. That is the routine blood test, thyroid function test that include TSH, T3, and T4. You will do an ECG, you will do RBS and cholesterol levels. So there is no symptomatic treatment here. The specific treatment here is levothyroxine. So I will explain to the patient that the gland in front of your neck, which is called thyroid gland, is under functioning, and because of this, you have low level of hormones in your body, and these hormones are responsible for different functioning of your body. That's why you are feeling tired, and there is weight gain, and you have this constipation. So what we are going to do, we are going to give you a tablet that contains the same hormone to replace the hormone in the body. This is a tablet that you need to take daily in the morning with water on empty stomach. Okay, so you have to give these direction to the patient, because the taking of levothyroxine is very important. If the patient takes it with after breakfast or with food, then it might not work. Okay, so tell them they need to be taken in the morning on empty stomach, and then breakfast should be eaten after 30 minutes. Okay, because food should not be eaten for at least 30 minutes after taking the tablet. And you should also tell the patient that it takes 7 to 10 days for levothyroxine to reach the appropriate level in the blood. So you might not feel any improvement for the first 1 or 2 weeks, okay? But you still need to take this medication regularly. Follow-up, we need to do regular follow-up with the GP so that the GP do regularly your thyroid function test and adjust medication according to that. Here we are replacing the levothyroxine. So again, we will safety net the patient for thyroid storm. If the patient take more than the normal dose, then they may experience thyroid storm. So we'll safety net them. And that if you experience any rising body temperature, diarrhea, vomiting, or irritability, then please call 999 or come to the emergency department. Okay. Uh, so the point here, the take-home point here is to remember that GP can give levothyroxine but not carbimazole. Carbimazole is under the domain of endocrinologist. And remember not to confuse hypothyroidism with the cause of weight loss. I've only discussed it here so that it might not be forgotten, because hypothyroid is also a very important case. So I hope it was helpful, and I'll see you soon in the next video.